Some of the things that we see are, your very common patient intake processes, just capturing your name, your date of birth, and not having to write that 46 times on 20 different pieces of paper. Proving that, you know the patient, where they came from, what their background is, and you're not having to ask them the same questions over and over. It improves the patient experience. It improves the physician workflow. All that information gets put where it needs to be. We also see things like referral intake is another big one. How do you bring in information from an outside ecosystem? Like, you cannot enforce readily at this point doing anything other than in fax or phone calls or a paper trail of some kind to push that information to a new organization or a new facility. So being able to give them a way that they can do that and reach out beyond what their environment is and bring in those affiliates into their ecosystem is also going to be revolutionary, I feel, for the industry. I feel like the clinical space has been very well saturated and very well cared for in terms of providing tech, but really the administrative space is where the ball kind of got dropped. Nobody was paying attention. All of that work kind of happened in the shadows, behind the scenes, behind closed office doors, and nobody ever thought about it. So now with Streamline, you can bridge that gap between the clinical and the non-clinical world. Even things like medication reconciliation, that is a huge problem. A lot of patients have very long lists of medications that they are taking, and there's very specific information about those medications that needs to be tracked and managed. And one of the big barriers is you have drug-to-drug interactions, right? So before a provider prescribes a new medication, they need to know what they're currently taking and how those drugs are going to interact with each other. And be able to educate the patient appropriately. So building these simple workflows out where we can say, okay, I understand you have rheumatoid arthritis and you don't want to have to write out these 15 medications over again. Here's what we know. Please tell us if that's still accurate. Maybe do a little bit of updating. And that immediately gets written back to a space in the EHR where the physician can see it instantaneously versus trying to have to walk around the office and figure out who set down that piece of paper and where did they put it, because now it's of no value. Putting it on paper and sending it down on your desk, it might as well have not even been done, right? Because that's when you walk back to the office and then you have to orally recount everything that you already wrote down on paper. So again, just being able to bridge that gap, and the sky's the limit, really, in terms of what you need done. You can build it out, and we're not going to dictate the workflow for you.